So today, basically, I'm going to talk about heart disease, focusing what we call coronary artery disease. You know, when people get heart attack and sudden death. So I'm going to divide this discussion in 3 or 4 headings, and after each topic, you know, if you have any questions, we can discuss that as we go along. So first of all, we should understand basically as an individual, what is my risk of developing heart disease? So, you know, heart disease is obviously age dependent. Some people do get it prematurely, but the rough age we say, if we take consider of any kind of ethnicity, for men is 40 plus, for women it may be a bit more. So first of all, you understand who you are, and you have to go back to your roots, right? Before you start thinking about yourself. Try to understand which particular disease runs in your family, what medical conditions your parents have, or your uncle, aunts have. So heart disease, as you know, runs in the family in majority of the cases. It can happen without any family history, but in majority of the cases, it runs in the family. So please do try to find out if your parents have got any particular illness. It's not only heart disease, but other risk factors like high cholesterol, high blood pressure, diabetes. These are all risk factors of developing heart disease. So that's one thing. Now let me give you an example. If you are, say, 35, 36, but one of the parents has developed high blood pressure or has been taking cholesterol tablets when they were young, or unfortunately one of the parents had a heart attack in their 50s or underwent a bypass surgery in their 60s, and this is what we call a positive family history. So that's important. Try to understand your family history, and if you have a positive family history, then you must visit a doctor to find out or calculate your risk. So that's number one. The second question is, as an individual, how I'm going to define myself. So basically, I'm talking about my lifestyle. What do I eat? Have I been eating healthy? And when I say healthy, we need to understand what healthy diet is. And am I exercising regularly, or my lifestyle is very sedentary? My other habits, do I smoke? How many sticks I'm smoking? Is it 5 or is a pack? And then, last but not the least, what is my stress level? Because it does matter. So first, identify yourself as an individual, look back at your family history, and then you decide where you stand. You may be an entirely healthy individual, or you may have some what we call cardiovascular risk factors. Now, what are these cardiovascular risk factors? One is family history, which is genetic. You can't do anything about it. It's fixed. And then you have some variable risk factors, such as your habits, smoking, being overweight, not exercising adequately, or you have developed high blood pressure, or you have high cholesterol, or your sugar level is a bit abnormal. So these are the risk factors. And then the symptoms. Now, I'm focusing today mainly in people who doesn't have any symptom. We will talk about the symptom, but let's talk about a normal, apparently healthy person, no symptoms, what they're going to do. So as I have mentioned about the family history, the lifestyle, things like that. So if you think that something is not right, then obviously it's time to go to your doctor and have a discussion. So how do we do health checkup in an individual who do not have any symptoms? You may be someone who is like in the early 30s or late 30s. you're fine. So you come to us and we take a history. As I've mentioned to you, if you have family history, we dig a bit deeper. And then we check your blood pressure, we do your blood test. And then we discover, oh gosh, you know, your blood sugar is not right. You're not diabetic, but your sugar level is abnormal. So that's what we call pre-diabetic condition. You haven't developed the diabetes. You're about to develop diabetes unless you do something about it. Likewise, your cholesterol may be high because of unhealthy habits or family history. That's where we come into the picture and give you advice. Likewise, blood pressure. So our job is to identify the risk factors which can lead to develop premature heart disease. We can advise you, suggest you, counseling you about your habits, unhealthy habits, if you've been smoking, if you're not exercising, if you're eating unhealthy. So we can intervene quite early and explain you how to prevent all these conditions. So that's what is a health checkup in a nutshell. But as a cardiologist, my job goes beyond that. For me, just blood pressure check, few blood tests is not good enough. So I go beyond. I go only beyond when I see there is a person who has got risk. So again, I'm giving an example. Imagine a 38-year-old gentleman has come to me and his cholesterol is borderline high. Now remember, there's nothing called a high or a low cholesterol. Okay, so this is important. What is normal for me may be abnormal for you. So it's the cardiologist who will try to calculate the risk of that level, particular level of cholesterol. So this gentleman in his late 30s come to me for a general checkup, and I discovered that his cholesterol is so-called borderline high, not high enough to be treated. And then while we were having a chat, he told me, you know, doc, my father had a heart attack when he was, you know, he was 53. And that's the time I become a bit concerned, because I'm seeing a 38-year-old gentleman whose father had a heart attack without not much of risk factors at the age of 52. Now, this 38-year-old can be at risk, and if I cannot identify his risk now and try to prevent it, then he may develop heart disease in his early 50s. So what do? We do a treadmill test, exercise test. Now, it's a primitive test. This test does not become abnormal unless the disease is very advanced age. Now, this 38-year-old does not have advanced disease. He has got very early disease. Now, that's what I'm going to find out. Because of the advancement of technology, we use CT scanners, simple CT scanners. Nothing will go inside the body, no injection, just a bit of X-ray, and it will check the health of the heart arteries. Now, imagine this 38-year-old who, you know, leads a very healthy lifestyle, doesn't smoke, goes to gym, but he has problem in his heart arteries, which was detected by the CT scan. He has calcium, which he shouldn't have. So what happened? The cholesterol first sits inside the heart arteries, it builds up, and then calcium goes and sits in the cholesterol plaques. And we pick up the cholesterol. This is very simple, very cost-effective test. Now, I know this 38-year-old who's looking healthy, his heart arteries are not 38 years of age. It has aged a bit further, like his dad perhaps. So now this borderline cholesterol needs aggressive treatment. It does not require lifestyle modification, because believe me, lifestyle modification is going to help up to a certain extent. What he needs is medication so that his cholesterol comes down, and we prevent the risk of having heart attack or heart disease by 45%. Now that's huge reduction. Lifestyle modification perhaps give you a benefit of 10 to 15% max, but medication does help. Now this gentleman who came for a checkup now understand that medication is compulsory to prevent heart disease in the near future. So this is the kind of checkup we do, or we should say screening. For me as a cardiologist, if you ask me which is the single most risk factor which I can manage and give benefit to my patient, and that is cholesterol, cholesterol, and cholesterol. Believe me. So it's important that people do check their cholesterol levels. So these were the risk factors I've said: family history, high cholesterol, diabetes, high blood pressure, way of living. So these are the risk factors, and we as a doctor look into these risk factors and guide our patients accordingly, either by counseling, motivating to do better things, doing tests to detect disease early, especially heart disease, as I mentioned about the calcium scoring CT. This is something which a lot of people that still don't know is very cost-effective test. And then last not but the least is to make them aware, to look after themselves. Okay, so that's our job. Any questions so far? Anyone would like to ask me a question on this particular topic? No questions? Catherine?
Hi, doctor. No, that's fine. Go ahead.
Okay, can I carry on now? Okay.
Yeah, that's fine.
So,
thanks.
So that's the risk factors and the way we sort of check the risk of patients. Now let's come to the symptoms. What are the symptoms that we would be aware of? We do see a lot of patients with various symptoms, right? But let me just tell you one by one so that you understand. Headache. If you are having headache and you don't know why you're having headache so frequently, then you may have high blood pressure. Headache, dizziness, lack of concentration, irritability, losing temper very easily are the symptoms of high blood pressure. So if you have been having these symptoms, get your blood pressure checked. If you are overweight and if there's a family history of diabetes and you're feeling thirsty, going to the loo too frequently, you might have developed diabetes. You must check your sugar level at that point. So being overweight, eating too much of carbohydrate-rich food, going to the loo, feeling thirsty. Cholesterol. Now, high cholesterol, as I told you, it's one of the greatest risk factor. It does not give you any symptoms. That's the problem. You will only find out when it has already caused some changes to your heart arteries. So it's important that if you have reached 30 years of age, get your cholesterol done and do ask your doctor about the levels. And then palpitation. Heart is racing, heart is beating fast, or heart is beating erratic, can cause some heart rhythm disturbances. This is the commonest presentation in young people, by the way. And these are benign, these are not sinister. But they have to have a checkup by an ultrasound of the heart to ensure that there is no structural heart problem, because they may have some heart problem. Thyroid abnormalities can cause palpitation. But the commonest cause of palpitation is anxiety and stress. If you are having palpitation, fair enough, you don't have any significant heart disease, but you do have anxiety, you do have stress. Now that's not good for your health. So by going to a doctor or a cardiologist, you're going to rule out the underlying, say, 15% serious causes of heart disease that can cause palpitation. At the same time, when you hear from a doctor that, look, your stress level or your anxiety is affecting your heartbeat, then you become concerned, you know, because unless someone points out to you, look, this is what's happening, you know, you don't take any actions. But last but not the least, the most sinister symptom is chest discomfort or pain. Now, this is the killer, what we call angina leading to heart attack. So by definition, Any discomfort above the diaphragm, you know the diaphragm, the muscular plate which divides the chest from the abdomen. Any pain here, just beneath the nipple to up. It can go up to your jaw, this pain, or to both arms. So mainly in the middle of the chest, anywhere in the chest, in between the shoulder blade, going down to your arms, going up to the neck, to the jaw, is a sinister pain. And it's usually a pressure-like feeling, crushing, a gripping sensation. It may or may not be associated with shortness of breath, sweating. It may come at rest, but mostly it comes on exertion when you're doing some physical activity. And as soon as you stop doing that activity, it gradually weans off, it disappears. So you may not be having chest pain, you don't have heart disease, you may be only 35, but your uncle, your parents, or even your colleague who is 50 years of age may be having these symptoms. And if you have noticed this, then I think as a colleague, as a relative, it's your responsibility to advise or guide this person to go and visit a cardiologist before the heart attack strikes. A rule of thumb is, if anyone having this chest discomfort for more than 10 to 15 minutes, then the patient should be taken to nearest emergency room, to a hospital, via an ambulance. Now, this is a very important thing I would like to mention. Why ambulance? Anyone who looks sick or is going to faint or is having severe chest pain, yes, you can take the person to a car and go to the hospital, but calling the ambulance help, because in the ambulance are the paramedics who do have the knowledge of first line management. They have equipments to assess the vitals and take the patient to the most appropriate place if there has to be transferred. So yes, if you have a very critically ill patient, dial the ambulance and get the patient transferred. Now, I work in a hospital setup where we have services of treating heart attack patient very quickly. So when one of the heart arteries get blocked, people have heart attack. So this patient has to be transferred to the hospital as soon as possible. Why is that? Because this disruption of blood flow is going to cause permanent damage to the heart muscle, permanent damage. The more you wait, the damage gets worse and worse. So what happens when this patient comes fairly quickly to the hospital, we take them to cath lab. It's a kind of procedure room. And through angiogram and angioplasty, these are procedures where we take pictures of the heart arteries and we unblock the arteries, okay? And as per any international standard, as a doctor, we are supposed to open up these heart arteries within 90 minutes of hospital arrival, okay? So we do it very fast. So please remember, if someone is having any chest pain and you're suspecting that the patient is having a heart attack, please, please, please don't wait or don't allow them to wait at home. Call the ambulance, ship to the hospital so that we open up these heart arteries as quickly as possible. So that's the heart attack. And let me tell you one thing, we are seeing more and more patients of cardiac arrest. People are collapsing, having a cardiac arrest. And I must say, you know, the social media and everything, people are more aware. They can give the cardiopulmonary resuscitation or CPR at home. And these people are surviving now. About 10 years ago, it was unthinkable. So yes, very critical ill patient having massive heart attack, cardiac arrest, they can also survive if they receive the treatment. So that's, in a nutshell, again, in 15 minutes, the symptoms of heart disease. And now, at the end, I would like to tell how to keep your heart healthy and young. We age with time, every minute, every hour. Our body is aging, it's an aging process. So imagine this scenario. we have two person here, two men or women, 40 years age, Mr. A and Mr. B. Both of them are 40. But I can tell you, by age, chronologically, they are 40 years of age. But believe me, their internal organs, whether it's heart, the brain, the stomach, the liver, they are not of 40 years of age. Okay? This is what we call biological age. The biological age are different. How? So our gentleman A, he smokes 20 a day. He doesn't exercise, eats unhealthy, very unhealthy food. He does have family history of heart disease. His cholesterol is high. His sugar is borderline. And the other gentleman, who is Mr. B, is not overweight. He exercises regularly, non-smoker, eats healthy, doesn't have any family history. If I have medical checkup in these two gentlemen, believe me, Mr. A would definitely fail in some way or other, whereas Mr. B will pass with flying colors. I won't be surprised to discover that Mr. A, who has failed, who's 40 years of age, has a heart health of a 50-year-old gentleman, whereas the Mr. B, who is healthy and passed the medical checkup, his heart arteries or heart may be 5 years younger than his actual age of 40. So have this concept in mind. Whenever I see my patients, I try to understand the age of their organs, of their heart in particular. So have that concept of what is your age, what could be the age of your organs, because if you keep your organs healthy, you're going to survive not only longer, you're going to enjoy your life. The quality of life will be really wonderful. So I think I'm going to conclude here today. Any questions will be, very welcoming, to tell the truth.
Dr. Syed, could I just ask you maybe just to talk a little bit more about cholesterol and younger people? I suppose when I say younger people, there seems to be more and more, particularly here in the UAE, high levels of cholesterol in 30-year-olds, early 40s. I know because I manage wellness for our clients, and a lot of these groups of people, like in their 30s or early 40s, seem to have high cholesterol, and I'm just wondering, if you could maybe give some tips on if that can be reversed, or maybe looking in terms of nutrition, if that can be monitored in some way.
Yeah, it's a very interesting and intriguing question. A lot of my patients ask the same thing. The cholesterol, as you know, which is a fatty substance floating inside in our blood vessel, in the bloodstream, the level depends on two factors mainly. One is that person's lifestyle. When I say lifestyle, it's again two things: the diet and the exercise, along with the habits of smoking or not being smoking, right? So that's factor one. The second factor is hereditary, genetic, because liver produces or destructs the cholesterol. Okay, so liver is the factory where the LDL gets manufactured or get destructed. So that is also important, and that's been determined by your gene. Certainly we can improve our lifestyle, we can eat healthy, and we can do exercise. Now, when we say eat healthy, you may be knowing better because you're a nutritionist and you give advice. My way of defining nutrition is very simple. Believe me, this is what I follow. I'm going to have 5 portions of fruits and vegetables. Number 1. You'll be surprised if you count how many 5 of fruits and vegetables individuals have. You'll be surprised. I find very few people who have 5 a day, right? In fact, in the original recommendation by the American Cardiac Society was 7, but 7 portion is too much. So what I meant by 5 portion is handfuls, 5 handfuls of fruits and vegetables. So let me give you an example. In the morning, you have freshly prepared orange juice, a glass. That's 1 portion. In mid-morning, you have a green apple or something, 2. Lunchtime, you have a bowl of salad, 3. Number 4, again, at dinner, you have some spinach, broccoli, some vegetable, nice vegetable. That's 4. Again, bedtime, if you like, you can have a fruit. So that's 5, right? So that's very essential. And your fruits and vegetable has to be colorful, right? The fruits should not be sweet. That's again, you can't have melon and mangoes and watermelon full of sugar, carbs, not good. So try to have some more, colorful fruits, mostly berries, citrus fruit, pineapples, things like that. So that is important. Second is low carb, high fiber diet. Carbohydrate is worse than fat. Okay, so try to shift to plant-based fat, avocado, seeds. I don't tell my patient to stop eating red meat. No, they can enjoy red meat in moderation. But again, what kind of cut they are having, that's important. They shouldn't be having meat with lots of fat in it. So that's the diet in a nutshell. And mind you, there are 2 particular nuts, almonds and walnuts, which increases your good cholesterol, HDL. If you stop smoking, then the good cholesterol goes up, bad cholesterol comes down. So smoking has got a great role. If you exercise, if you lose your weight, or even if you don't lose your weight, if you exercise, your bad cholesterol will go down, the good cholesterol will go up. So this is the lifestyle which contributes to your LDL level. But my interest is mainly to the genetics, because there are a lot of people who have this genetic predisposition of producing bad cholesterol in the liver. So yes, your lifestyle is going to help you. Definitely, everyone should be encouraged. But as a specialist, my job is to find out whose liver is producing high cholesterol. So how I do it, I do a baseline cholesterol in a person. And if I discovered that there is a highish level of cholesterol, then I give them 3 months. I say, look, go do some good work, improve your diet. This is your diet. This is the diet should be like. Do some exercise, lose some weight, come back after 3 months. I think 3 months is good enough to have a reflection of your changes in cholesterol levels. So I repeat the cholesterol in 3 months' time. If there is significant improvement, I'll keep encouraging the patient to maintain that healthy lifestyle. But if I don't see that improvement, that clearly tells me that this gentleman's or this lady's cholesterol is not predominantly governed by the lifestyle. It is the liver, right? So how much of lifestyle improvement this person is going to have, it's not going to make any difference. So now I have got a person whose liver is producing high level of cholesterol. My next step is now to look into the heart arteries, depending again on family history. If there's some family history, then I give more emphasis. But my practice now, as per American Cardiac Society's guideline, if someone has got so-called borderline cholesterol, I do a CT of heart arteries, okay? As I mentioned in my talk at the very beginning, if the CT shows presence of calcium in the heart arteries, this is the person for medication. because mere lifestyle changes is not going to help, because this atherosclerosis or deposition of cholesterol in the heart arteries is a complex, chronic, inflammatory process. It's like having an arthritis, okay? If you have an arthritis, lifestyle improvement is not going to help it unless you do something about the inflammation process as well. And cholesterol lowering tablet, in fact, is an anti-inflammatory medication to the heart arteries or any blood vessels in the body. It's an anti-inflammatory, right? And it does reduce deposition of cholesterol in the heart arteries. So I'm a very proactive person when it comes to lowering cholesterol. You know, if you have changes in the heart arteries, lifestyle changes is going to help, but not up to that extent where the medication is going to help. Now, before I conclude in this section, I would like to mention about the cholesterol lowering tablet, which is commonly known as statins. Believe me, I preach what I follow. I've been taking statins for the last 15 years, though my cholesterol are very reasonable. Why I've been doing it? Because I see the benefits of statin. Unfortunately, there's a bad press about statin. You know, why is that? I haven't got a clue. I haven't got a clue. Most of the people read the blogs and find things in the social media, and that cause the water muddy. Do you know what I mean? They are really beneficial in people who really needs them. That's the message. And it is our job as a cardiologist to identify those people who's going to get benefit. The side effects are not serious. And as we say, they have got a lot of side effects. I don't believe it, okay? Scientifically, the side effects are very minimal and they're not life-threatening. To give you a good news, the future is bright. There are now injections where you give twice a month for people who cannot tolerate the statins. But the future is 2 injections per year. If someone needs cholesterol-lowering medication, they just have to have 2 injections in 1 year, and their cholesterol will be reduced and they will prevent heart disease and stroke. Catherine, I think I might have managed to answer your question.
Yes, Doctor, thanks for that. Yeah, maybe other people might have some other questions. So,
sure.
Doctor, good afternoon. I have a question.
Yes, please go ahead.
All right. Is having an sleep apnea is an alarming symptoms of having heart disease?
Sleep apnea, in fact, is nothing alarming, to tell you the truth. But yes, if you don't treat it, then in the long run, it will cause some negative impact to your heart and brain. If someone has got sleep apnea, then the common advice we give is please reduce your weight. You'll be surprised there are a small group of people who are not overweight, but they're having sleep apnea because they have narrow passage in the airways. But if you are overweight, then certainly you need to lose your weight to have relief from sleep apnea. Some people ends up using the machine called CPAP. So if you don't treat the CPAP, then eventually you are at risk of developing an abnormal heart rhythm, which is not good for anyone. It can cause excessive pressure to the heart, making it weaker, causing heart failure. Again, these are not something which cause sudden death or will cause a rapid deterioration of someone's health, but this will cause chronic illness. You know, it will affect quality of life of the person. So yes, if someone has got sleep apnea, then I think it has to be addressed and treated properly.
All right. Thank you, doctor.
Thank you. Anyone else? No?
Doctor, I just might ask one other question. Obviously, with COVID and everything that's currently happening at the moment, I think a lot of people are suffering with stress and anxiety, and you know, it's bringing up a lot of concern for people. And I suppose I love the saying, "Prevention is better than cure." So certainly, you know, I'd always try and encourage people to look for preventative measures for anything before, you know, anyone has heart attacks or anything that severe. So in terms of stress and panic attacks, could you maybe share some insights how to prevent someone, say, having a panic attack or an anxiety attack from a preventative measure? That would, you know, obviously the last thing you want to happen is having any heart problems, but
Sure. Well, you know what? I was purely a cardiologist before coming to Dubai. I was looking, you know, on high-risk patient. But since I've come to Dubai, I've been seeing more younger people because Dubai has got younger population. Being a very fast-moving, ultra-modern city, stress is there. So I see a lot of patients with stress. And over the time, I have developed my own way of counseling them. Thank you for raising this question. So this is what I think. Stress is there in everyone's life, but it's important that you learn to control the stress. Controlling stress is not easy. It's like riding a bicycle for the first time, okay? It's difficult. It's frustrating to control the stress. You will fall off from the bicycle several times. You will get hurt. But the persistent is the word. You have to be persistent in understanding your stress and trying to control it. Now, one size does not fit all. Whatever I'm going to tell you may not help you to reduce your stress or control your stress, but you can try, okay? When I'm having consultation, I often ask my patient, what is your hobby? And to my surprise, a lot of people say, my work is my hobby. No, that can't be your hobby. No, shopping cannot be a hobby. Social media cannot be a hobby. So, and watching television can't be a hobby, right? If you are watching a lot of news, it cannot be a hobby. So a hobby is something which you do outside your working environment, which gives you pleasure, which gives you a sense of achievement, a satisfaction, where you put efforts, right? So that is a hobby. Now, a hobby can be anything. If someone tells me reading a book is a hobby, I don't consider it as a hobby because, you know, you're just spending time in reading the book. Reading the book may be stressful, to be very frank with you. I keep telling my patients, please adopt exercise, any form of exercise as your hobby. Make it your habit. Now, exercise can be of any form. It can be jogging, it can be going to the gym, it could be brisk walk in the streets, it could be biking, hiking, or even waking early hours in the morning going for fishing, you know, something which will keep you engaged, which you will enjoy. So I personally feel everyone should have a hobby where they spend some time, put their passion into it and forget about everything. And it helps. And you know what? In our life, we're engaged with everyone and everything. Hardly we have time for ourselves. You ask yourself, how much time do you give it to yourself? just for yourself, and you will be surprised. You don't have any time for yourself, right? So you have to give your time to yourself when you're engaged in this hobby. So get into a hobby, and preferably if it's exercise, then fantastic. So that's one, hobby. If hobby is not your exercise, then do exercise. Again, a lot of people say, doctor, I don't have the time. Number one, I'm so busy. I go at 7 o'clock, coming back, not 7 o'clock in the evening, 8 o'clock in the evening. Then I ask, okay, how many days are you off? Some say 1 day, some say 2 days. Okay, fine. You start off on those off days, even if it's Friday, right? Give 1 hour, 2 hours for some form of exercise, whether it's swimming, bicycling, jogging, whatever. Start with once a week, twice a week, and then you will hook up into it. Why you will hook up into it? Once you start seeing that you're doing more and more, you're running now 15 minutes from 5 minutes. When you see that you're losing weight, it's a satisfaction. When you feel that you're not feeling heavy or feeling lighter, you will get hooked into it. So if you can manage to do exercise 3 days a week minimum, that's fantastic. You can do your exercise in your room. American Heart Association, I was impressed. They published an exercise where a woman exercised for 45 minutes in a corner of her room, increasing her heart rate to 150. Unbelievable. You've got all these bands and strings which you can buy and do all these muscle exercise. You see, if you exercise, you will have these endorphin chemicals releasing in your body which will make you feel better. That will take off your stress, and it will improve your immunity. When you're talking about immunity, this is what you do. If you do exercise, you are increasing your lung capacity, you're increasing your immunity, and you will prevent COVID than someone who is not active. So in a nutshell, to release stress, you can engage into a hobby, do exercise. Last but not the least, now it can be a bit, I don't know, some people get upset about this. Often, sarcastically, I write in my prescription, quit your job. Now, if you're doing a job where you are so stressful that it's affecting your life, then it's you who have to bring some changes. Either you try to modify the way you are working, you know better, bring some change to reduce your stress. You must bring the change. If you don't bring the change, it's going to affect your health. So please, do your work slightly differently, modify your work, speak to your colleague, to your line manager, express. Mental health is a big issue, it's a taboo. I don't want to say, look, I'm depressed. I don't want to tell anyone, look, I burst into tears this morning. Because we feel embarrassed. We shouldn't be feeling embarrassed. If you have an issue, go to your colleague, go to your lineman and say, look, I'm stressed. I'm not having a good night's sleep. I need some support. Or you guide me. How can I lessen my stress? So do share your problem up to a limitation so that someone can help you. Don't bottle it up inside you.
Doctor, if you don't mind, I'm just reading a question in case you haven't seen it. So one of the joiners has asked, are there any particular diets that you consider very bad for cholesterol, example, keto? So maybe if you could share some insights on that, that'd be great. Thanks.
I won't say keto diet is a bad diet. I believe keto diet is something which you're not going to follow forever, isn't it? It's for a time frame where you can lose weight. Fine. If you want to do that, fine. If you're going to lose weight, because losing weight is important. There are two worries regarding keto diet. One, if you're a high risk group person, when I say high risk, I'm talking about if someone is 40 or above, has got other risk factors, strong family history, then for them it's better to avoid it because they are now unnecessarily increasing their risk by making their cholesterol going higher. But otherwise, for a younger person, it should be okay. I have no problem with keto diet. So that's a concern. The high risk group people should not adopt it. The second worrying thing is, once you get into keto diet, it's like addiction, isn't it? Carbs, fat are like smoking. You get hooked into it. So once you start a keto diet, some people cannot come out of it. They keep repeating it. They found an excuse. They have lost 0.5 kilograms, half a kilograms of weight with keto. Okay, I'm going to do the keto again. And they end up having 3 or 4 cycles of keto in a year where the cholesterol has been persistently high. So yes, keto is fine for you if you see it's helping you to lose the diet. No problem with that. But don't make it a habit. That's the only thing. I hope that, that answered your query. Any other questions? Hello.
Hi, Doctor. I'll just read out another question from one of the joiners. Someone has asked, I understand that a normal resting heart rate for an adult is around 60 to 100. Does this vary on certain factors like men versus women, age, or will this help identify if someone has a healthy heart? If you could just share some insights. Thanks.
People who have a lower heart rate lives longer. There has been some research, but don't take it very seriously, okay? But having lower heart rate is good. Having lower heart rate and you're fine means that your heart is not working very hard. With a lower heart rate, it's keep you going. So that's a good news. Yes, the heart rate varies as per gender. Females, they usually have a slightly higher heart rate than men. That's gender-wise. People who are more active, they have a lower heart rate. An example, footballers, they have an average heart rate of 35, 38, because their body is so fit. So having a lower heart rate is good. If someone is overweight, their heart rate will be higher invariably. Because our body, our heart has been sort of programmed in such a way that it can carry so much of weight. So if you are overweight, your heart would work harder. So overweight people, obese people have a high resting heart rate. Most of the time is above 90. Now, if someone is having high heart rate and they're feeling it, then they should have a checkup. The common cause, let me tell you why they should have a checkup. It's a simple blood test. The blood count, hemoglobin, especially in women, if they're anemic, if the hemoglobin is low, they will have a faster heart rate. If you correct the hemoglobin level, that will disappear. And the second common cause is the thyroid, right? If there's a problem with the thyroid gland, as you know, thyroid is responsible for metabolism, then the heart rate may be higher. So yes, there are treatable causes for fast heart rate. The other cause for fast heart rate is your personality. Are you an anxious person? Do you become quite anxious very quickly? Then the heart rate will go up. And last but not the least, if you have a heart rate of near about 100, and if you're getting tired easily, exhausted easily, then you should see a cardiologist, not an internal medicine doctor. So heart rate reaching 100, going beyond 100 in more or less resting state, and you're feeling tired and lethargic, then you may have a heart rhythm thing, which is called inappropriate sinus tachycardia. So in a nutshell, majority of the fast heart rate are due to anxiety, your lifestyle, if you're sedentary, if you're overweight. So that's the common cause. There may be some medical reason, not so serious, need a checkup. But if someone is having persistently rate, fast heart rate, then they should go to the cardiologist. There's a small group of patients I see a lot is when they go to the gym and they realize that their heart rate is going up disproportionately and the heart rate is not normalizing during the recovery period. The recovery period is prolonged. That's another group. Again, it's nothing serious, but it's our responsibility to identify this group of people and then advise them accordingly. Thank you.
Hi, Dr. Syed. We have another question. What's the latest science around cholesterol ratio and triglycerides? I hope I pronounced that correct. Against measuring just bad cholesterol. So just because my LDL is high, does that mean I'm in trouble?
You know, it's an old-fashioned thing. I don't look at the ratio anymore. Ratio is okay for a general physician, but for me, it doesn't. Unfortunately, it doesn't make any difference. LDL, the bad cholesterol, is an independent risk factor for an individual. This ratio thing does not correlate clinically. This ratio has not been vastly looked scientifically. There has been some data in the past, that's why we give the ratio, right? But with the modern medicine, it's the LDL we particularly look at. We do look at good cholesterol, the value, and also triglyceride. You see, all of them as an individual is a risk factor. So we have to look at them individually. The ratio is something I don't believe, and I don't use it in my practice, unfortunately.
I don't see any more written questions, Doctor. I'm quite conscious of time as well. So unless anybody has any other pressing questions they want to share. Okay, I think that's okay for now. Dr. Syed, thank you so much for your time. It's been lovely to get some of your insights, and I hope the session's been beneficial for everybody who's joined today. So thank you.
Well, thank you for attending. You know, I really enjoyed talking to you guys, though I didn't see any one of you. But I really enjoyed, and you know, one lesson which you would like to take home from this discussion, I would say, you know, is exercise. That's it. Okay.
Great. Thanks, Doctor, for your time.
Take
care.
Thank you,
Working on it, Doc.
Bye. Bye-bye.
Bye.
Thank you.